right, hello, this is Dr. Matthew Buckley, and this is the third in a series of interviews that I'm doing with practitioners that we're bringing into the Revive Clinic, sponsored by Divine Biome at Anarchapulco for 2020, February 10th through the 20th. And this interview, I've got Drs. Les Feinberg and Dr. Matt Godl, and they're going to share what it is that they're bringing to the table. And I just want to say that these two gentlemen have been instrumental in my career, having influenced me in a number of ways in relationship to energetic medicine. And Les truly has changed my perspective on life in general. And once you get an understanding of what it is that he's working with and see what's possible, it literally will change your view of the world. So I'm really happy to have them joining us. And you guys want to just pop on in and tell the community what it is that you do and what you're bringing to the table.
I'll go ahead and begin. I'm Dr. Feinberg, and I've practiced mind-body medicine for 42 years, and of course I know what you're thinking. He doesn't look that old, but the fact is that I've had the opportunity to study and to practice just about every one of the different general styles of mind-body medicine. And the thing that I became aware of about 20 years ago is that all of these methods were really trying to do the same thing, which is to redirect the mind-body to look at physiological operations that it had once decided on incorrectly, resulting in disease, with the idea that the mind-body could, with a different perspective, take a different choice that might lead in the direction of healing. Some of these methods were based upon things like radionic vials that we would use. Some were based on acupuncture points or reflex points. And the thing I realized, though, is that it was all a kind of stylized dialogue to allow the mind-body to reconsider physiological choices that had been made before but been made incorrectly. And recognizing that, I understood that if we could create a kind of dialogue directly with the mind-body, and we could do that with very specific crafted dialogues that revolved around particular areas of physiology, inflammation, allergy, pain perception, emotions, that we would be able to create a informationally rich dialogue that would allow the body to recognize these errors and give it a choice or give it an opportunity to move in the direction of healing. And so that's what we've done. Began teaching this work in 2002 and developing it ever since then. And this year, this coming year, 2020, we'll be starting the NeuroModulation Technique Global Healing Network. And this is really exciting because it'll allow patients from all over the world to be paired with experienced certified NMT practitioners and to be treated remotely. So no longer does a person have to be in a community that has an experienced NMT practitioner. Now NMT will be available to folks all over the world.
Okay, so that's a mind-boggling concept for people to understand. But you changed my world by demonstrating to me the ability to access information remotely and accurately, and to create transformations remotely using intention. And the principles behind how that works is really rooted in a couple different well-established quantum physics principles. Would you want to share that with the community so they have an understanding of what this is rooted in?
Sure. In quantum mechanics, according to John Stuart Bell, the physicist who wrote a paper on this in 1964, the entirety of the universe is entangled, meaning that there's an illusion of separation between all of the individual things that we see when we look out in the world. But the fact is that it's not true. And it's an artifact of our perspective. But what's been demonstrated since Bell's paper in 1964 is that indeed, at all levels of organization in the universe, everything is entangled, which means that there is no separation. And the separation that we perceive between myself and you, or myself and anyone else that I interact with, is not entirely real. The result of that opens up a lot of opportunities, because it also means that all of us are part of, if you will, a universal mind. We all obviously have our individual self, our individual histories and perspectives, but being part of a larger domain of mind means that we're all linked at a very essential level. And it gives us the opportunity, if we recognize that that opportunity is there, to engage our intention, to engage our awareness in a kind of mind-body communication that facilitates the sort of healing that we practice in neuromodulation technique.
And I'll say that aspect of remote healing is what really turned me on to NMT. I had spent the prior 10 years practicing applied kinesiology, and I had started to get interested in remote healing. And I was using applied kinesiology with this whole illusion of separation, that this person is off in the distance, so I have to really pour a lot of my energy into fixing this person. And this was back in 2003 when I took my first NMT class. And at that time, I had been treating my brother who had had a diving accident in southern India. So he had spinal compression of the neck and thoracics. And right after my first NMT class, I did NMT on my brother in India. And the difference between the paradigm that I was using in AK to that of NMT was remarkable. It was like the butter was heated before I sliced it with a knife. And after that, I was absolutely hooked.
Yeah, I was actually, when I was, I think I was out of practice or in practice for maybe a year or two. And I remember talking to Matt. I was like, Matt, what's new and great? You know, what have you come across? And Matt was like, NMT, man, you got to go check it out. And so that's what led me into seeing it or finding less. So I went to a seminar, and my experience with NMT was that I was dealing with a wheat sensitivity that was so severe that if I just had like a little bit of wheat in a substance, that, within probably an hour, I'd be fatigued. My joints would start to hurt, and then the next day I'd be depressed. And it was just a ridiculous sensitivity. And I did. Les has this thing where he has these seminars, and I commonly do treatments where people will have anaphylactic reactions to different substances, and in one session he's commonly desensitized them to a point where they can have it and they're not experiencing that reaction. And so he asked us, well, is there anybody here that has a reaction that they'd like to have treated? And so, of course, I raised my hand, and he ended up bringing me up, and I was the guinea pig. And I didn't tell him at the time, but I had a chronic sore throat too. And so as he's doing his protocol, this algorithm to help identify where my system is disorganized and to provide coherence to properly see a new path of healing, I could feel my throat was actually starting to feel better. And I said, like I said, I said nothing about that. And by the time he had completed this session, which was about 15, 20 minutes, I mean, I felt a number of things that had changed. And I'd eaten a whole chocolate chip cookie at the seminar, and like I had none of those reactions. I just felt such an amazing transformation. And having experienced that, that's really what sold it on me. So that really, really, it changed my life. And so I would say if anybody is dealing with any chronic issue, or they've tried everything, NMT is definitely something to consider.
Dr. Buckley, there were probably 75 times over the last 18 years in which I've taken a person from the audience in a seminar, brought them on stage, somebody who was anaphylactic to a food. In every single case, we've gone to the point of testing very carefully after treating them and finding that the body said it's not a problem anymore. I want to tell you a story. This most current one is over the past 2 months, in which a young man in his mid-30s with eosinophilic esophagitis came into my office. Now, this is a condition where there's an allergic reaction, and what occurs is the esophagus gets flooded with eosinophils, causes it to swell, and food gets lodged. And this particular fellow has had 6 surgical procedures this year to stretch the esophagus in order to remove the food that was stuck acutely in his esophagus, not allowing him to either to swallow or to vomit it up. And after 5 sessions, the testing that I did indicated that, in fact, all this reactivity had resolved and he wouldn't have a reaction. So I asked him at the next session to bring some peanut butter and some tofu, the idea being that these 2 things, soy and peanuts, that triggered him, would at least not get stuck in his throat if they're very soft, like peanut butter and tofu. So at that point, we introduced both of these, and he had absolutely no reaction. He went home. He said, I'm going to try all these different foods and such that have triggered me over this past year. And he did that over a period of 2 weeks, was back last week, absolutely no reaction. And so that was essentially the result of 5 NMT sessions, which I think is pretty remarkable.
That's very remarkable. So could you just describe what a treatment actually looks like?
Yeah. When we do a treatment, typically the patient would be in my office, although that's not necessarily the case. They might be sitting in a chair at their home, and we would be on Skype or some other video conferencing kind of application, or just on the telephone. There's nothing about the technology that enables this work. It's just a matter of convenience to be able to communicate. The testing that we do, I spoke of testing before, and this is a kind of muscle response testing in which we're trying to monitor a response from the patient's body by way of muscle testing. And so in doing this, we use the testing to try to understand what the particular nature of the confusion is in a person who's having a set of symptoms, because 2 different people with exactly the same symptoms may have very different causes of those symptoms. That testing leads us to what we call NMT clinical pathways. And those pathways are really structured dialogues, informationally rich dialogues that revolve around some area of physiology. As I mentioned before, perhaps it's allergy, perhaps it's autoimmune inflammation, it might be pain perception, it might be autonomic imbalance. But by selecting the NMT pathway that's the most appropriate, you might say that we've selected an informational lens to allow the mind-body to look at its troubles, its problems. These dialogues then may be a number of specific questions about some physiological process the body's engaged in, revolving around the particular complaint that they have. The process of going through that dialogue, step by step by step, reestablishes an understanding of the physiology that was once decided by the body, but erroneously in a way that led it in the direction of the complaints that the patient is presented with. And the result of going through that then informs a different set of choices, a more healing-centered or healing-directed set of choices.
Right. So an important point for people to comprehend here is that your conscious mind controls about 3% of your physiology. Your subconscious mind is controlling the rest. And as an NMT practitioner or muscle tester, you're querying, you're accessing the information that's coming through the subconscious mind.
Absolutely, absolutely. Because the conscious mind is really overrated. I mean, I make the same mistake that we all do and think that the cherry on top of the sundae of life is our conscious mind. But the fact is that the much bigger part of what we are and who we are is at the subconscious level. And that's where all of the critical decision-making occurs that either results in our going in the direction of healing or going in the direction of disease.
Right. And so using kinesiology, you're using this as a tool to gain a window into the subconscious. And understanding NMT, you recognize that there is no separation, and you're using your intention to deliver the changes within somebody's system.
That's right. There's a resonance that occurs, as Rupert Sheldrake spoke of. Rupert Sheldrake of Morphic Field fame. And so as we come together, a practitioner and a patient with the intention of interacting for their benefit, we open up these channels, these subconscious channels of communication. And since this dialogue is silent, it's unspoken, we have to monitor it. And the muscle response testing gives us what we call an external indicator. In other words, my subconscious mind has already interacted with the subconscious mind of the person that I'm working with. But it may be difficult for my conscious mind to completely access the result of those responses. But muscle response testing gives us an observable external indicator that allows us to see an affirmative or a negative response of the body to the questions that we ask.
Right. So you've actually had a few studies that have been done and published. Could you go ahead and talk about that?
I'd be happy to. Our first study was in regard to what are called alveolar cavitations. And so these are areas typically where there's been an extraction of a tooth, and the alveolar bone, the bone that the teeth embed in, goes through what's called osteonecrosis. Following the removal of the tooth, there's a loss of blood supply, the bone deteriorates, and there are cavitations that can extend to large areas of the alveolar bone. We had, I believe it was 10 people in the study. We used cavitat testing, so we had dental surgeon, an oral surgeon, I should say, do this transalveolar ultrasound to image the osteonecrosis. So we did this at the beginning of the trial. Each of the people in the trial was treated with NeuroModulation Technique and monitored with 1 or 2 follow-ups. And the result at the end of the study was that we had, I believe it was 82% resolution, meaning restoration of bone, these dead areas of bone restored with healthy living bone in 82% of the cases, which is slightly higher than the best surgical results in the best oral surgery clinics in the country. So that was really exciting. The second study was done, it was overseen by Robert Weiner, who's a psychologist, PhD in Dallas, Texas. And this was a study of NMT in the treatment of 5 to 10-year-old autistic children. And this was, we had tremendous results with this. So very exciting to do this work and to now have a little bit of exposure where people can actually read papers about the results that we've been able to achieve with NMT.
Mm-hmm. Matt, do you have anything you want to share in terms of what you've seen? And
I've seen so many quote unquote miracles that I've lost track of them all.
Yeah.
And miracles, when they're explained, cease to be miracles. Right. And so, and each year for symposium, Dr. Feinberg and other NMT practitioners come up with these awesome new additions, building upon previous work. And it keeps expanding and becoming more powerful, more effective, with less effort, in my opinion. When I first started doing NMT, there was a learning curve, and it's highly intellectual, highly mental. But as we've progressed, these pathways become more succinct. It seems effortless now to engage with the patient, find out what the etiology is, and find out what the correlative pathway is for resolution. And I see miracles every week. And especially, I really get a kick out of working with patients with anxiety and the autoimmune patients, because these people have suffered so long, and there are only so many limited allopathic remedies. And for us to work with 30 minutes on the phone with the patient and have them completely relaxed or their inflammation substantially reduced with one session is very, very rewarding.
It is remarkable, isn't it, that we see folks who are acutely anxious or depressed, people who are really in tough shape. And at the end of a 30-minute session, they'll tell us that, it feels like it was somebody else's troubles. Doesn't feel like they own it anymore. And that's just such a beautiful thing to be able to facilitate that for somebody. Obviously, it's their mind body that does the healing, but our work involves revealing that path to them.
Mm-hmm. When I think about NMT, I think about the movie Avatar, and you remember that scene in Avatar where you have all these the natives. They get in a circle and they have this intention that they're carrying, and that's how they do their healing. It's all based off of intention. and it has such a transformational effect. And when you understand what NMT is, and you experience, and you know that that's the reality, then you can see like what our future could become. And I really don't think it would be much different than what is presented in Avatar, honestly.
You know, one of the things that I've thought about is what would be the impact on healthcare in the United States, let's say, if NMT practitioners were routinely inserted into hospital settings, emergency room settings, group clinic settings, and that once, let's say, the initial evaluation was done to ensure that the patient didn't require emergent Western medical care, they could be treated with NMT. And I think that there would be a tremendous saving in terms of cost of healthcare. There would be a tremendous improvement, I believe, in terms of decreasing the dangers associated with healthcare, because we would be able to maximize the body's ability to efficiently express its innate healing potential. And that would mean that the number of situations that a patient would be forced into a surgical or pharmaceutical alternative would be less. And to the degree that's true, we would imagine that the cost and the danger associated with healthcare would be improved greatly.
No doubt about it. Okay, so you're coming on in, and if people are going to want a session, do you know what days you're going to be at the event?
I believe we'll both be there from, is it the 10th to the 20th?
Yeah.
Yeah. So I think we'll be leaving, I believe, the 17th, but we'll have hours from, Matt, you'll remember, I'm sure.
Yeah, so it's 9 to noon, and then 2 to 5, I think, something like that.
I believe that's correct. Yeah, 6 hours of availability for both of us per day.
Okay.
So folks will be able to schedule with either of us.
Okay, and so you'll be doing hour sessions, half-hour sessions. How's that going to work?
We'll be doing half-hour sessions. Usually, depending on the situation, we might recommend an hour. It would depend on the person and what they want to accomplish.
Okay.
We'll also be teaching a workshop, excuse me, on muscle response testing, which I think will be really exciting because it's such a powerful tool, but it's often taught in a very superficial and kind of cursory way. And we use muscle testing at such a deep level in NMT that we've developed some kind of unique approaches to ensure the validity of the result that we get, to check specifically when we get a result to see that, in fact, it represented what we believe it represented, as opposed to just some glitch in the performance of a muscle, let's say, that might have happened at that particular moment.
Right. Yeah. If you're interested in muscle testing at all, I would highly encourage you to take a session, with Les. If you don't learn and choose not to learn NMT, you should at least have the perspective from a muscle testing standpoint on how he cuts through a lot of the dogma that exists within muscle testing, and will, I'm sure, change your perspective on it and probably sharpen your skill set.
It's the quickest way to access the other than conscious and connect it to your conscious mind.
Yeah,
it is. And, the muscle response testing that I teach can be used with any kind of mind-body medicine.
Right.
It's not exclusive to neuromodulation technique, but the style and the methods that we use are kind of unique and offer some potentials that we haven't seen in other kinds of muscle response testing.
Okay, well, I think we kind of covered what it is that I wanted to get covered for this this interview today. And is there anything else that you all wanted to share?
No, it's been wonderful visiting with you, and we're both really excited about coming down in February and meeting all the folks who will be coming to Anarchapulco 2020.